Good afternoon. Thank you so much for joining us today. We are so excited to have you. Happy Wear Red Day. I already saw some of you on video wearing your red. I love it. Thank you so much for joining us today. I just want to say we are so excited to celebrate National Wear Red Day, kick off the Heart Walk experience, and take some time to focus on our heart and health. Before we get started, I just want to share quick housekeeping. Please join us on camera and show up your red. Please mute your audio when you're not speaking. And click speaker view at the top of the screen to see who is presenting. And lastly, please interact. We have the chat box, share your questions, comments, feedback. We want to hear it all. So let's get started. I'd like to recognize our generous Heart Walk sponsors in the Westchester and Putnam regions who are acknowledged here on screen. Thank you so much. And we have a packed half hour. So let's begin by introducing our guest, Dr. Patrick Thomas. Dr. Thomas is a physician with New York Presbyterian Medical Group, Hudson Valley Cardiology, chairman of the Medical Executive Committee and chief of cardiology at New York Presbyterian Hudson Valley Hospital. He has been a dedicated volunteer for the American Heart Association for many years, so you may recognize him, and currently serves as a member of the Westchester County Board and on the Eastern States Board. He is a board certified in cardiovascular disease and nuclear cardiology, and graduated from Cornell University and received his medical degree from Columbia University College of Physicians and Surgeons. Welcome, Dr. Thomas.
Thank you, Megan, and certainly welcome to everybody here that's joining us on a somewhat dreary winter afternoon as we get ready to hopefully celebrate the nice weather coming in the spring for the 2021 Westchester Putnam Heart Walk. And it's certainly going to be a little different this year, as Megan will tell you when I wrap up over the next 10 minutes or so. But we've got some exciting things in store for the Heart Walk experience this year. Just a quick word about my own experience with the American Heart Association. I can tell you I'm now in my 16th year of volunteering for the American Heart Association in one manner or another. And I can tell you that it's really easy to see my why, as in why am I part of the American Heart Association? Well, first off, I'm a cardiologist. So everything I do on a daily basis in some way or another has been funded or researched or set out in guidelines published by the American Heart Association. But I also have a personal reason as well. Both of my parents had heart disease at relatively early ages. My father, in fact, was in his late 30s when he had his first cardiac procedure. And both of my parents passed due to heart-related complications. So it's not only professional, it's personal. And I expect to be volunteering for the American Heart Association for many, many years to come. And certainly would encourage everybody here, if you're not already volunteering, to think about it. And it's a wonderful way to give back to your local community and help us fight the single biggest killer of men and women across the country, even in the COVID era. And I do want to take just 1 minute and talk a little bit about COVID-19. My main job is to talk about exercise today, and those who have heard me speak before know I am very passionate about exercise, and I'll get to lots of that in a moment. But I do want to mention the role of COVID-19 and heart health and how the American Heart Association has helped in that regard, as you may have seen with some of the introductory slides that were shown. We know that people who are ill enough with COVID-19 to be hospitalized often have heart problems associated with it. In the beginning, we weren't entirely sure why this was happening. At first, we thought maybe it was due to direct virus attacking the heart, but now it looks like the heart damage that we see in people who are suffering from COVID-19 is more related to the aggressive inflammatory response your body has in a serious COVID-19 infection. And the heart is almost secondarily damaged by that inflammatory response. So it's unlikely for the vast majority of people that it's the virus directly attacking the heart. One of the things we don't know is how long this heart muscle damage lasts, as in, is the damage permanent? Is the damage temporary? We just don't know. But the American Heart Association is at the absolute forefront of trying to figure that out. And they have a registry, a collection of patients that they are studying and following, almost 20,000 of them at this point, looking at what their outcomes are going to be and following them sequentially over the next months and years to help us figure out whether or not this heart muscle damage is in fact something that people carry with them forever or whether it's temporary. Irrespective of whether you do or do not have heart muscle damage with COVID-19, one of the single most important things that you can do to help protect yourself against any illness, whether it's viral or any other type of illness, is to exercise. And that's really what the Heart Walk is all about. It's about encouraging people to take that first step forward and get into a regular exercise program. Yes, medicines are important. Yes, diet is important. And I don't want to minimize the impact of those very important pieces in this puzzle, but I think exercise is more important than anything else. The amount of exercise you want to get, it's relatively simple, 150 minutes a week. That's less than 2.5 hours, give or take. And it can be divided up. Roughly about 30 minutes, 5 days a week is the easiest way to remember that. The type of exercise is irrelevant. It doesn't matter whether it's an exercise bike, a treadmill, an elliptical, a Zumba class, kickboxing, dancing, whatever, something that gets your heart going. You want to do for about a half an hour, 5 days a week. And that has been shown conclusively over and over and over again in the clinical studies to dramatically reduce risk of heart attack, stroke, and death. If 30 minutes all at once is too much for you, break it up. 5-10 minutes here, 5-10 minutes there through the course of a day. Yes, 30 minutes all at once is probably a little better for you than broken up, but I'll take anything, okay? Anything you can give me, I'll take. And maybe you can only do 5 minutes at a time to start, and you really don't have the energy to do it for the rest of the day. That's okay too. Slowly build yourself up. What I'd ask you to do is if you're, let's say, doing 5 minutes a day to start, after the first week, try to make it 5.5 minutes a day, 6 minutes a day. Small little increments to increase have a dramatic impact on your overall physical as well as your psychological well-being. One of the things we've seen during this pandemic is people are much more sedentary. People are eating out of stress way too much. People are also consuming incredible amounts of alcohol. In fact, I saw a statistic, 56% increase in alcohol sales in 2020 compared to 2019. All of these things are potentially detrimental to your heart. And no, you can't necessarily fix everything all at once, and nor do you necessarily want to try. But taking that first step forward, right? Going out to take a walk, right? Putting on some streaming videos of aerobics classes, anything to try to get you moving, right? Try to burn off that COVID 15 pounds that everybody seems to have put on over the last year or so. You know, the Heart Walk is, again, a great start. If you're not exercising, it's a great way to start to get motivated. And it's also a wonderful opportunity to raise money for the American Heart Association. A lot of the money raised during the Heart Walk experience and throughout the year stays right here locally. Yes, some of the money goes to fund research on a national basis, fund guidelines on a national basis, but a lot of the money stays right here in the local community. And I would encourage you not only to get out there and walk, but also form a team, join a team, and raise some funds for this wonderful organization. I can tell you the Heart Walk experience, when Megan explains it to you, you're going to see is a really great way to keep up healthy habits, stay socially connected, and keep up with physical activity. And so I think with that, since we have a relatively limited time today, I'm going to stop. I'll throw it back to Megan. And of course, if questions come up that people would like me to answer, I'm happy to do so.
Thank you, Dr. Thomas. I will say that I saw a question come in about as people age, is there a caution about too much exercise?
I get this question almost every single time I speak. It's an interesting one. And the answer is yes, there is such thing as too much exercise. And we know, for example, that marathon runners and ultra marathoners, people who do 100-mile runs, people who do run as much as they can in 24 hours, they do seem to be at higher risk of sudden cardiac events happening. But for most of us on this Zoom chat right now, I'm going to guess there really isn't too much exercise per se. That having been said, having a day off a week, so 5 days, 6 days of exercise is great. 7 days might be a little much, especially as we age and get older, where our bodies need some time to recover. The ligaments, the tendons, the muscles need a little bit of time to recover. And so certainly if you've not started an exercise program and are thinking of starting, I certainly wouldn't jump right into 5 days a week. And I would aim more for, let's say, 2 or 3 days a week, making sure you have at least a day off in between each session to heal up.
If Dr. Thomas is here for the remainder of the half hour, so if other questions come in, we will try and get to them. And if they don't get answered in this exact time frame, we will follow up with the answers to your questions as well. So Dr. Thomas, thank you so much for joining us today again. And, just want to reiterate that moving together is the ultimate goal of the 2021 Heart Walk experience. The Heart Association remains committed to funding groundbreaking research and helping people live healthier lives through walking together. So we're still relying on your steps to bring our mission to life. And, during this time, we're all looking for more ways to connect. To be honest, morale can be low, whether we're working at home or in the office or in the field. People, as Dr. Thomas said, they're not moving as much, and we're not eating as well, and we're not, overall being as well. So that mental resiliency. I'm sorry, did I hear somebody chime in? Oh. So that being said, that's why the American Heart Association created the new Heart Walk experience. And this year will be the biggest we've ever seen. And I've got a little pom-poms going. We are excited to bring this to life. This is going to be a tremendous experience. By moving the action online, we're going to reach more people by bringing the experience straight to you. So we'll touch more hearts, we'll move more feet, and raise more life-saving funds than ever before. This experience is designed to boost team spirit, employee morale, and just a sense of feeling socially connected to one another while rallying behind the mission of the Heart Association. So where do we start? It is Heart Month. It is February. This is recruitment time, and today is Wear Red Day. Today is the day. So number one, register. If you haven't registered, go to westchesterheartwalk.org or putnamheartwalk.org and sign up. If you're not registered, you will miss out. Starting next week, we're sending invitations. They'll be coming your way to community conversations focused on CPR and AED awareness and training, virtual activities to get you moving, and a plethora of other things. So please sign up. Number two, recruit. The Heart Walk experience is not only about moving more, it's about coming together as a team and connecting with others. And we make it very easy. Log into your Heart Walk headquarters on the website or on our new Heart Walk app and invite people to join you with just one click. And once you've done that, you and your team will be immersed in the participant experience. So I just want to go to what is at the center of this experience. It's our new Move More Challenge. This 30-day physical activity challenge launches at the beginning of March. And Dr. Thomas was just saying, it doesn't matter how you break it up or get it in, that as long as you get it in, and we have a way for you to log it and track it and have some fun. So this is how it works. You download the Heart Walk app. You can only participate if you have the app. So please go do that. Log your minutes of activity. And what's great about this is that it also syncs with other wearable devices. And start walking. But it's not just about walking. Any activity counts. So biking, hiking, skiing, dancing, just get moving. And finally, compete. This is, kind of where the fun comes in. There will be challenges, rewards, a leaderboard, and winners will be recognized and celebrated. So Ultimately, this leads up to our week of wellness, which runs from Friday, March 26th through Thursday, April 1st. What does this look like? First, we have Healthy Food Friday. We'll share a heart healthy recipe and celebrate the Heart Association's work in the community to combat food and nutrition insecurity, a rising problem right now. Survivor Saturday is when we'll celebrate and recognize heart and stroke survivors in our community, many of whom are here today. So a big shout out to you for joining us today. Thank you. Save a Life Sunday will focus on CPR and knowing the signs and symptoms of stroke, so we are prepared to act. Move More Monday features a Heart Association virtual workout. Take Action Tuesday, you'll be challenged to take an action to improve health, whether it's quitting smoking or quitting vaping, or using your voice to speak up for improved health policies. Wednesday is Wellness Wednesday, a day to practice mindfulness, reduce stress, and focus on blood pressure. And finally, the finale will celebrate and recognize all the healthy activity and steps taken to end the life-saving funds raised. So that is what we are working towards. And it all starts today. So to reiterate, 1, register, create or join a team, and recruit your teammates. Use our tools, do it in minutes, and get it done in one day. 2, download the HeartWalk app. We want to make sure everyone is ready for the activity challenge. And 3, get a jump start on your fundraising. It's Wear Red Day. It's on people's mind. Heart health is on people's mind today. So it's the perfect day to start. You can send emails, text messages, post on social media, and if you have any questions, I'm here. And to make it fun and a little competitive, we'll be giving out virtual awards next week to the companies and teams who recruit the most participants and who fundraise the most between now and Monday at noon. There will be other competitions along the way, but let's get things started with this one. This is our chance to enjoy movement, to boost our mood, have fun with our family, friends, and coworkers, hear inspiring stories from survivors, and engage in some friendly competition, all while we're staying healthy and wherever we may be. And speaking of inspiring stories, I want to conclude today by meeting 2 local families who have experienced firsthand the life-saving work of the American Heart Association.
It was a Saturday. It was a day I was coach of my son's soccer team. At one point, just walking back from a play, I started to get dizzy, almost like when you get up quickly and you see stars. But I would say it was that to the extreme, where there were a lot of stars. And then I believe I went down. I passed out or went down on the field.
So I was actually home, and I'm about a mile and a half from the school, and a friend of ours who was another parent there called me and said, "You have to come to the field. Dave collapsed." And I didn't really know to the extent of what happened, but based on what the stories that people have told us, there was a couple of there was a ER doctor playing with his child's team on another field, and one of the parents on our team ran up to the other field to get the ER doctor. Then there was a mom who was sitting in her car who saw the commotion going on, but really didn't know actually what happened. And most people thought he was having a seizure, but she was on the athletic committee of the school and knew that there was an AED in the school, which just happened to be open on a Saturday. No, normally that's not even open, but they have play practice. So she ran into the school, got the AED, and ran down to the field. And she tells the story that, when she was running down to the field with the AED, all she could think of is that everyone was going to laugh at her, that she overreacted. In the meantime, the ER doctor was doing the CPR, and, he, after a certain amount of time, he looked up and was like, "I need an AED." And this mom appeared with the AED basically just at the right time. When you listen to the stories of the dads that were there, they all felt helpless because nobody knew what to do. Nobody could even step in and help the doctor with the chest compressions when he started getting tired. All these stars weren't aligned, and there didn't happen to be an ER doctor on the adjacent field, and it didn't happen to be, and the school didn't happen to be open, and somebody ran to get the AED. I don't think the outcome would have been the same.
We had a basketball game in Pelham, New York that day. So we took the bus, and the bus actually got off at the wrong high school. So we went to the middle school, actually. And in the parking lot was an off-duty police officer that ended up being one of my teammates' cousins.
Game starts, Jordan comes off the bench, he's the sixth man, gets in the game a couple minutes in during a foul shot after a teammate had made a basket, and he just started to wobble, and he fell. He just kind of collapsed backward. And I saw this just from my vantage point. Basically, the police officer he talked about ran onto the court. Parent in the stands, who's orthopedist, parent of one of Jordan's teammates, ran onto the court. So we're all over Jordan, and the police officer ran to his car. He was super fast thinking. He didn't even look for the defibrillator on the walls of the high school. It wasn't on the walls of the gym. It was actually out in the hallway somewhere. And I looked at the parent, the other parent who was on the floor with us, the orthopedist, and just asked him, "Do you want to do CPR on him? Do you want me to?" Since it's my kid. And he just jumped on there and started doing chest compressions really hard. And then the police officer came in with his defibrillator, used it once. It actually didn't spark any activity in Jordan, and he required a second shock.
Well, the other thing that I have learned since then is not only how important CPR is to save his life, but the fact that how lucky we are that he doesn't have any neurological delays is also, from what I've learned, is also partly because he did get CPR right away. Dane and I live in the same town, and we were acquaintances, during school. Our kids are in the same grade. And then after we just started talking, we decided to really pair together and take it to the next level. Once I started driving around town and looking where our AEDs were in town, asking, do the coaches and our volunteer sports have CPR training? The answers were coming back as no.
What happens is people just assume there's protocols in place. We started looking at that, and like Alice said, we prepared this, worked with the town village and recreation department, the EMS, our police department, and developed a cardiac emergency response plan for the village of Brybrook, where all volunteer coaches are trained in CPR. We have AEDs accessible all through town, and we added signage.
Right.
So having that positive feedback, at least from the town, then it kind of motivated us to take it to the next step to a county level. The message in general for parents or for anybody is to learn CPR.
Yeah. Yes.
CPR saved, and an AED saved our family member's life. And, most times you're going to need it to save somebody's life that you know or you love. So being prepared is so important. And for parents just to understand what sudden cardiac arrest is, what the risks are, what the warning signs are, but also that most times there are no warning signs. So the best thing is to be prepared and learn CPR.
So I just want to give a shout out to Dana and Alice. I know, I believe they're on the call today. It's hard for me to see as I'm presenting, but they've organized Saving Active Hearts to advocate alongside the American Heart Association for AED and CPR training and awareness. So not only are they involved in that aspect of the Heart Association's work, they're also participating in the Heart Walk. And last year, their Heart Walk team raised nearly $5,000. So thank you to you both. I do see a few other people on who I want to give a quick shout out to. Pat's Platoon, you guys are already started, and looking at the past 3 years, I don't know if you've achieved, but you're definitely closing in on $25,000 over the past 3 years. So thank you. Howard Klein is a top walker of ours, having raised $15,000. New York Life, as we're talking about recruitment and participation, I will say that they've doubled their team size in the past 24 hours. So when we're thinking about those virtual rewards that we're going to be announcing next week, they're the ones to beat starting out because they've got some momentum. So and Kim's Heartbeats, they're also beginning their fundraising and already have made a dent in it. So thank you to them and all of you for being so wonderfully supportive of the Heart Association and participating in our mission and driving it forward. So there's so many fantastic teams, and many of you have joined us today, so thank you. I just want to kind of wrap up towards the end and say, if you need any assistance, I'm your staff partner and I'm here to help. I look forward to working with all of you. My contact details should be on the screen there. And I want to thank Dr. Patrick Thomas again for his expertise in volunteerism one more time, as well as our local sponsors. This couldn't be done without all of you. One final thank you to everyone for participating today, and for bringing our community together by registering and fundraising for the walk. We cannot do this work without you. Collectively, our efforts will bring our reimagined Heart Walk experience to life, and I hope you're as excited about it as I am. We are supporting the 120 million Americans who have one or more cardiovascular condition that put them at a higher risk for COVID-19 complications. And I know a lot of the conversation today has been about cardiovascular disease and the effects, and the research that we're doing is looking at both the heart and the brain in light of this current pandemic that we're in. So we are the American Heart Association, we are the American Stroke Association, and we are proud to be furthering the science to help both heart and stroke patients and prevent heart and stroke incidents. So while this year is different, the mission of the Heart Association to be a relentless force for a world of longer, healthier lives is more important than ever. And together we can fight heart disease and stroke to save more lives. Thank you so much to all of you for joining us today. Happy to work with you moving forward, and please reach out if you have any questions.